Hi friends, I hope all of you are doing fine. Yesterday I was doing a case of full mouth rehab teeth preps, and when I was doing the preps I thought I would make a small video of how to classify zirconia, because this is a very common question that I get, that we get confused when we have to classify zirconia and select zirconia for the same when it comes to restoration. Now, so I was just making a small notes of my presentation as well, so I thought I will just put a small video and let you all know what is the real classification of zirconia. Now, when it comes to zirconia, you all know that zirconia is not metal free, it's a white metal, but some literatures also classify it as a metal free ceramic. There are literatures, there are two schools of thoughts in this, but I would stick on to the old school of thought where it says that it is a metal restoration, which is a white metal. And the classification of zirconia is basically based on the yttria that is present in zirconia, the content, the percentage of yttria. Now, when it comes to, I'll just simplify it into a very basic concept, very simple concept. Now, when the percentage of yttria is 3%, now let's split the percentage of yttria into 3 to 6 and 8. When the percentage is around 3%, then the translucency of the restoration of the final zirconia is less and the strength of final zirconia is more. So understand that as yttria concentration or yttria percentage is less in zirconia, the translucency also becomes less and the strength becomes more. So if I want to go with probably a multi-unit bridge, or if I want to go with probably a screw retained full arch implant restoration, or multi-unit restoration when it comes to screw retained implant, then I might have to go with yttria which is less of percentage in zirconia, around 3 or 4. When it comes to more percentage, like 3 to 6%, or more than 6 to 8%, the translucency increases and the strength decreases. So I can go with something for an anterior zirconia, let's say, or for a veneer, or for probably inlay or onlay, where I need a little of translucency as well along with strength. Okay, so that's how you select zirconia, based upon the percentage of yttria. So revising back again, 3% is equal to less translucency and more strength. Anything more than 3%, like 6% or 5%, is equal to more translucency and less strength, right? Now, when it comes to 3%, it is called TZP, which is also known as tetragonal zirconia polycrystal. Okay, so I've just written down a notes. I'll try to put this also online whenever it is possible. I'm just finishing my presentation for this. When it comes to 3 to 6%, it is called PSZ, which is partially stabilized zirconia, and when it comes to 6 to 8%, it is called CSZ, which is known as the cubic stabilized zirconia. Okay, but we are not much bothered about cubic stabilized zirconia. We are much bothered about only two phases, which is your TZP and PSZ, tetragonal zirconia polycrystal and partially stabilized zirconia. So TZP is usually used for single crowns in the posteriors, where I need more strength, multi-unit bridges, or probably inlays, onlays and overlays of posteriors like molars, where I need more strength than translucency. And when it comes to PSZ, partially stabilized zirconia, I would probably use that for veneers or an anterior single crown, where I need more translucency and probably the strength is not a factor for me to select. This is the basic classification which we need to remember when it comes to the classifications. Now, when it comes to the type of zirconia that we need to select, 3Y and 4Y, whenever we select a 3Y and 4Y, it is usually high strength, because as I said, 3 is equal to more strength and less translucency. 3Y and 4Y is equal to high strength. So whenever you select a zirconia, ask for 3Y or 4Y when you need crowns for posteriors, when you need inlays, onlays and overlays for posteriors, and when you need multi-unit bridges or multi-unit implant bridges, screw retained restorations. When it comes to 5Y and 6Y, these are for anteriors, more of translucency and less of strength. So select it for veneer, select it for single crowns of anteriors where you need more translucency than strength that is required for the restoration. Now in these are now 3Y, 4Y, 5Y, 6Y are all monochromatic. They are single layer, so I can just put it as probably which is not having too many layers. So monochromatic and unicompositional, which I can call it as. Now when you want multi-layers, let's say, then you can go with polychromatic multi-layer. Just add M for it. M3Y, M4Y, M5Y, M6Y, same indications again. 3Y, 4Y with multichroma is equal to posterior crowns, single crowns or multi-unit bridges or multi-unit screw retained implant restorations. And when it comes to M4Y and M5Y and M6Y, you can come back to the anteriors with multichroma again. Okay, so for monoliths you have 3Y, 4Y. Then when it comes to multichroma and multi-unit restorations, you have M3Y, M4Y. So you just have to add M before the 3Y and 4Y to make it multichromatic and different compositions of the materials. Now, what are the common companies that are available when it comes to zirconia? And let's see which one you can take it for what. Now, suppose I am using Vita, let's say. I have gone for the commercial Vita, which is there. Then 3Y, 4Y, which is available with Vita, is YZT, YZST, and YZHT. So these can be multi as well as mono. You can select either mono or multi. So YZT, YZST, and YZHT. The commercial names of these are these. When it comes to 3Y and 4Y, what do I mean by 3Y, 4Y again here? It is single crowns. For posteriors, I need more strength. Multi-unit bridges, multi-unit screw retained restorations on tie basis. Now when it comes to the 5Y and 6Y or the anteriors, veneers, anterior crowns, where I need more translucency than strength, then I can go with YZXT. That's the commercial name which I can go ahead with. So you can select in the commercial company is also like which material I need for what. So just don't go blindly. Follow this classification, what I'm trying to say. It becomes easier for you to select material also, and you will be doing justice to the patient according to the area you need the restoration for, and you will also have less fractures if you do this. If I use YZXT in the posterior, which is around 5Y or 6Y, then it might break because I am using high translucency, low strength material in posterior. Vice versa. So you have to probably select the material accordingly. If I use a zircon, now I talked about Vita. If I use a zircon, then zircon base or LT is equal to 3Y, 4Y for posteriors. Zircon XT, which also comes in multi, again multichroma, which is used for anteriors. So accordingly you select again. When it comes to lava, lava plus for posteriors and lava aesthetic for anteriors. So when you talk to the lab also, you should talk like this. You should probably explain to the lab and ask, I need this for anteriors, I need this for posteriors. When it comes to Ammann-Girbach, Ceramil Zi is equal to 3Y and 4Y for posteriors. For anteriors, 5Y and 6Y, Ceramil Zolid FX, which is again, a single and multi chroma. You can either use single, which is called white, you can use multi, which is multichroma. So this is the basic classification of zirconia which you can take for. Emax is also there. Emax Zircad is there. In that, LT and MO is equal to for posteriors, and MT or multi is equal to for anteriors. So this is how you have to select. I'll try to post these classifications also. I just wanted to explain all this on a video and then post these because it makes clear. It becomes simple for you to understand. Okay, hope this helps. So use zirconia. Zirconia is a wonderful material. Use zirconia well in your practices, but when you select zirconia, select it according to anterior and posterior zones. Do the tooth prep well. Give enough amount of clearance when it comes to zirconia so that doesn't break. I see a lot of labs claiming that you need only 0.5, 1 millimeter because it's a monolith. No, you need at least 2 millimeters of occlusal clearance for zirconia. It doesn't break after that. And if you also select the material according to what I've told, take the classification seriously and select the material accordingly. Good luck.